I will now behave very sensibly. Oh, I've now got a transcript coming up, which no one needs. So I'm going to just close that. So my name's Daisy Russell. I work at the Council for Disabled Children here at the National Children's Bureau. And my job is all things SENDIA services and education law and some related health and social care law. So I'm just going to do a small bit of this, which is the law bit. And Reshmi, yay, is my colleague from the education team, and actually she can introduce herself.
Thank you, Daisy. I have to say I love working with Daisy. It hasn't been that long. So my name's Reshmi Copperthwaite. I am programme lead for the Education and Equalities team at Council for Disabled Children. And at the moment, I'm overseeing projects on early years and how we make it more inclusive for all of those children and young people with SEN and disabilities. But today we are looking at inclusive schools and what works. Now, Daisy and I wanted to make this quite a practical workshop. So we will be whizzing through some of the materials, but they are there in print for people to go back and look at afterwards. So welcome, everybody. Lovely to see you all. Now, tech, let's try it out. Brilliant. So first things first, we're going to go straight into an activity. Do people have phones? Bear in mind, I can't see anybody, so this is probably not a sensible question, but Daisy's going to nod at me. Do people have access to a phone? Yeah, so there is a code on the screen. If you use your camera to open the page, it's a Slido page, and we are going to do a quick word cloud so we get some ideas of what people think inclusion means in your context. Daisy, can you just give me a thumbs up when people have accessed that so I can stop sharing for a second?
Okay. There were no thumbs up yet.
Okay. Daisy, you're the only face I can see on my screen.
Oh, that is unfortunate for you.
It's a good thing right now.
But people are putting lovely people are putting their thumbs up.
I've got it up. It's working on my phone.
Excellent. 1 out of 15, I mean, isn't ideal, but is something. Well, you know.
There is a web link there for those that are on their computers, like us. You can type it in.
And it's not a huge group, so if anyone does just want to say if they're struggling, you can also do that.
Okay, I'm going to stop.
Okay, Jenny, but you know, you're doing as best you can. I'm going to put the link in the chat. Well, I'm going to put the link in the chat. Reshmi, can you put the link in the chat, please? I can't.
It appears not, but I will stop sharing for a second and attempt again. Yeah, it's a very slow process with no techie support. Okay, link coming up. Yeah, I'm seeing a nod. Think we're good. So, just going to start the poll off. Okay, and it should be open now. And people are typing, so that's good. So the question is, just for anyone that can't access it, what do you think of when you see the term inclusion? And we've got people are coming up with some words, so I'll just start reading them out. We've got fair access for everyone, community, feeling you belong, welcome. Brilliant. And I don't think any of us would disagree with those. And for those of you that can see your screens, there's the results on the screen.
We can only see you, my love. I can only see you.
Okay.
Which is actually lovely.
I don't know why that is, but yeah. Let's get this up again. Aha, I have Daisy back, right. So we'll figure out a way to share those words at the end. But for now, let's take a look at the Cambridge Dictionary definition of inclusion. So it tells us that it's an action or a state of including or being included, which is quite important because lots of school settings you might go into might have lovely policies drafted that say we include people, but if people don't feel included, and that's the key, how people experience inclusion. Daisy?
Can't see it, so we can't see the words.
What can you see?
Just darkness. I can see. Can you see them? Other people can see them. It's just me seeing darkness.
I can see the slides.
Yeah, we can see the slide.
Excellent. It's just me seeing darkness. Everyone carry on.
So it's about what we experience rather than just what we're told people are being. And then we've got the practice or policy of providing equal access to opportunities and resources for people who might otherwise be excluded. And we're talking about people with a physical or mental disability and members of other minority groups. Now, practice and policy is highlighted because really what it comes down to is what we do and how we do it. Doesn't matter what we see in print, if we're not actively doing something about it, we're not actively being inclusive. So, and quite a nice summary of what that looks like is everyone being able to use the same facilities, take part in the same activities and enjoy the same experiences, including people who have a disability or other disadvantage. So what that might look like in settings that you go into or that you work in or that people that you care about access is that if a PE lesson is going on, we don't have a separate activity going on for those with SEN and disabilities, that we find ways to make sure they're included in the activity going on. If children and young people are going out on a trip, it's not about leaving people behind because it's a bit too difficult. It's about finding ways to make sure that they can participate. And again, from a wider population level, it's making sure people with SEN and disabilities are visible. So being able to shop in the same shops at the same times that everybody else would, being able to take part in courses, training, etc., that everybody else would. Inclusion is about making the ordinary available to everybody. Still got darkness, Daisy? Brilliant. So first thing we need to think about is what does being in school actually mean for children and young people with SEN and disabilities? So in school or not, what does the data tell us? Children and young people with SEN support, so those that don't have an EHCP but have been identified as having an SEN or disability, are excluded at 5 times the rate of their peers that don't have SEN. The overall absence rate for those with an EHCP is double those without, and there's a rising trend of 5-year-olds being excluded. Now, the numbers are quite shocking. 7,000 exclusions in 2018 and 19, bearing in mind the climate at those times. So are all of these children and young people in school? That's the question. The law presumes that all children and young people with SEN and disabilities have the right to a mainstream education. Yet, there's a massive increase in home education from Ofsted, unexplained pupil exits from school, and we know from the research that children and young people with SEN are more likely to experience that. We know that there's poorer outcomes for pupils who leave mainstream school, and we know that for schools, there's sometimes what's considered a benefit to making sure that children and young people then aren't on those figures. So I think the research said that there's a 17% drop in those results when all children and young people that accessed education in those settings were included in the data. So thinking about the quality of provision for pupils with SEN, these are some of the things that Ofsted pointed out in their reports during inspections. So this is a school where the provision for vulnerable pupils with SEND is far from good enough. We've got senior leaders and trustees having failed in their statutory duties. They haven't provided reasonable adjustments to ensure that needs are met. And senior leaders have engaged in taking some pupils off the register by encouraging some parents to home educate or look at different schools for their children. So this is just building up a picture that things aren't looking great. And we know that from some of the data shared in the SEN review. But when we say being inclusive and children and young people in school, they have to actually be in school first for us to be inclusive. What about after education? Do things get better? Let's have a look. So these are the quality of life outcomes experienced by adults with learning disabilities and autism. So this set of data particularly is around learning disabilities. We know there's comorbidities and that often people with learning disabilities may have autism as well as other things. But for this data, this is specifically on people with a learning disability. So they often experience inequalities when accessing their local community. So when they're looking for jobs, using public services, including healthcare, social care, housing, criminal justice, and welfare. Shorter life expectancy, I think it's up to 20 years in some cases. Below average quality of life, high death rates, particularly during the COVID-19 pandemic. And again, for those with autism, they experience inequality far more than the general population. And it's more likely to be around being excluded from schools, receiving poor healthcare, being underemployed, and poorly served by the criminal justice system. So we know that they're overrepresented in the criminal justice system. So overall, the big picture is that things aren't looking good either at a school level or after school. So next question is, does it matter where kids are taught? Whether it's mainstream, whether it's special, whether it's alternative provision. An Ofsted report from 2006 looked at this very question, and what it found was that it's the type, it's not the type, it's the quality of the provision that's most important. So although they found that in many cases in mainstream schools they were better resourced and therefore had better outcomes, in general it didn't make much of a difference. But what did make a difference is that there was more good and outstanding provision in resource mainstream schools than elsewhere. So when it's done well in mainstream. And the key factors for this progress was having a specialist teacher. So we know that there's issues around teacher training and qualifications and expertise in SEN and disability. So having teachers that are really good at what they do and really understand the sector is important. Good assessment, challenging work. So not doing things that are repetitive, or because somebody's got autism, let's give them some matching activities. Looking at individuals and really finding stretch in what they're doing, and a commitment from school leadership at the highest level. So it's got to be driven from the top. What are some of the expectations and aspirations that we have as a society around our children and young people with SEN? So this is some of the thinking that we might come across day to day. We need to ensure that our education system stretches the most able, Ruth Kelly, and again, some children need extra help, support and encouragement to get the basics right. So let's take those two opinions there. We need to ensure that our education system stretches the most able, and then some children need extra help and support and encouragement to get the basics right. In the chat, what impression does that give you? If you were to see this around you, if people were saying these sorts of things, putting yourself in the shoes of somebody, maybe a pupil in school, what comes across? Let's get some opinions. Over to you, Daisy.
Here I am with my, well, not my opinions, because you'll hear enough about them later. So Kate has said, isn't that a comprehensive education?
Okay, Kate, can you expand a little?
Yeah, I mean, it's about having, you know, across the range, you know, pupils don't all fit into, they fit along a spectrum of need, don't they? Whether, regardless of whether they're SEN or not non-SEN, not everybody is the same. And so you would anticipate that you can't just hit the middle tranche. You need to have support and stretch across both ends of the spectrum, which was the comprehensive system, was to stretch the guys at the top, stretch the guys at the bottom, and meet the needs across the spectrum.
Mm-hmm. And I hear you, I take your point. And I think if you're, sorry, were you going to continue?
No, that was me.
Oh,
So
sorry,
you carry on.
I think if you're a child with SEN in school and your teachers at a ground level, practice level, and your teachers saying, right, Mister over here, I'm going to give you this work because you can do that quite easily, and you know this is really going to stretch you. And then at the other end of the spectrum, the teacher's coming over to you and saying, well, okay, well, you know, I don't expect that from you. We'll focus on this, but you'll do this really well. What are you expecting as somebody with SEN for yourself? What are your future aspirations if that's the message that you're getting, not just from teachers, but from society in general? So for some children, we aim for the stars, and for other children, just the basics is good enough. Anyone else?
Yeah, some other bits in the chat, which are those more able get a better deal, and I feel like focusing on those that can achieve and just floating, and those are not there yet. So, you know, we don't hear much about, it's difficult. We don't hear much about real ambition for children with SEND, and I think this is part of that. And I would also have a question about getting the basics right. Well, who decides what are the basics, and where do we do with children who might not get what we consider the basics right? So for a child who's never going to learn to read, possibly. So do they then no point in education? So I think there are some questions there, but we need to move on because, frankly, we're going to run out of time.
Thank you, Daisy, and thank you for opinions. So the culture around us. Are you confident that all your most able pupils are sufficiently stretched and challenged? This is the message given to teachers and teaching staff. It's crucial that our most able students fulfill their potential. We need to harness the talents of these students so they can become the next generation of business, intellectual and political leaders. If we succeed, it will benefit not only them as individuals, but our country as a whole. So again, the value in our system is put on who's the best business leader, who's got the biggest brains, who's going to be the next prime minister. What we're not focusing on is other quality of life measures and attainment measures that aren't necessarily academic. And that leaves out a whole section of our children and young people. And I think that's the point around this. What are the aspirations and expectations we're setting? So, and if we don't believe in our children and young people, how are they going to believe in themselves? So what does the law tell us? Daisy's going to answer that.
So next slide, please, Reshmi. This is just you will have these slides, so I'm going to do this quickly, But I think it's always important to remember there is a whole legal basis around inclusion, and at times when things are very difficult, it is really important that we remember that these are not just things that would be nice to do, or we could just try and ask if people will do. A lot of this is a must. It is the law. It is expected. So the SEND Code of Practice, very clear that the UK government is committed to inclusive education of disabled children and those with SEND, and there is a general presumption in law of mainstream. And talks about the Equality Act and the Children and Families Act. So this is, the foundations of children should be included into mainstream schools. Okay, next slide, please. So a couple of things, there's a whole list of things that schools must do, but a couple of them that are important. So they must ensure that children and young people with SEN engage in the activities of the school alongside people who do not have SEN. Everyone's got to have a SENCO, parents have got to know, and there should be a SEN information report, which includes admission arrangements, steps to be taken to ensure disabled children are not treated less favourably than others, and they should have an accessibility plan showing how they're going to improve access over time. So if you do nothing else with the schools you work with or in, go and have a look if you can see their SEND information report. Next slide, please. Okay, you'll know of the Equality Act. So schools must make reasonable adjustments to prevent discrimination. So they must all, again, this accessibility plans, and there's some really good resource there by Philippa Stobbs on how schools should be setting out how they make themselves more accessible. And important to note, this is anticipatory. So it's not just, this is the kids we've got in the school now. It is, how would you meet the needs of kids with disabilities if they are to come to your school? So you can't just say, oh, no, we haven't, never thought about a child like yours, so we definitely can't do anything. Reasonable, basically, the definition of it would be unreasonable not to, which you may think is unhelpful, and you may be right. But in the same way that for a school must make all, best endeavours. So it should do what it, the best that it can. So it would not be reasonable for a very old school to have to put a lift in, right? That would not be reasonable. It would be reasonable to move that child's classroom to the ground floor. It would be reasonable to put in a ramp. It would be reasonable for a group of children to spend lunch times maybe in the library, because they find, as lots of children do, break and lunchtime particularly difficult times of the school day. Okay, next slide. Is coming. So admissions. So what we often find in SEND services is a lot of children are excluded, not once they've got into school, but before they ever get into school, because they'd ever get into the school. So we have to be really clear that admissions authorities must consider applications of parents of children who have SEN but do not have a plan as part of the normal admissions procedure. They must not refuse to admit a child who has SEN but doesn't have a plan because they do not feel able to cater for those needs. They must not refuse to admit a child on the grounds that they do not have an education, health and care plan. So they must not be, and children with disabilities must not be treated less favourably than others in the admission process. You cannot refuse to admit on grounds of disability or SEN, in short. Next slide, please. So if you have an education, health and care plan and the child wants a mainstream setting, the local authority can only refuse if that placement would be incompatible with the efficient education of others, and there are no reasonable steps the local authority could take to avoid this. And that is a very, very high legal bar. So generally, they would have to really, really have a lot of evidence that would be impossible for the school to take that child. And if a school is named in an education, health and care plan, they must be admitted. Okay, whether they've got places in the school or not, they have to be admitted.
Surely that's the point. You should not be naming a specific education facility in an EHCP, because it's the council's duty to provide that education. We have this problem with particularly consultants who say, I think you should go to X school. The problem is that then defines in this what school they have to go to, when actually there may be perfectly adequate provision elsewhere. So this is one of the issues we have with the EHCP, and we try and avoid setting that specific into the EHCP. Otherwise, you are forcing the Education Authority to provide a specific outcome when they may have a perfectly good alternative.
Well, I
That's
mean,
already funded.
the parent will request what school they would like named, and it is up to the local authority then either name it or to prove why they can't name it. So that's how the law works.
That's a recipe for tribunal then.
Well, we have lots and lots of tribunals, as you will know, but more than happy to kind of give you more information on that at another point. And there is some stuff at the end of the presentation that you can have a look at, but that is the law as it is.
Thank you.
Okay. How to not make all children and young people feel welcome. So this is what happens. Not everywhere, not all the time, but this is what we hear quite a lot, which is why parents don't go for a particular school. We're a very academic school. We have a zero tolerance policy for all pupils. We treat everyone the same. It's a very busy and loud environment. Do you think they'll cope? I think your child will be much happier at the school down the road. And unfortunately, we don't have the resources to meet your child's needs. So once school starts saying stuff like that, as a parent, you hear, I don't want your child in my school. So even though that may be the school that's funded, maybe that is their local school and that is the school they might go to, as a parent, how secure do you feel and happy do you feel sending your child there? So you have to be really careful about the messages that people get from schools. But I've done a very quick bit on medical needs because I know it's quite a big health turnout. So there is a separate duty on schools to make arrangements to support children with medical conditions. So there is legislation on this. It's section 100 of the Children and Families Act. Okay, so this often these pupils with medical needs will also have an education, health and care plan, will have a disability, will have SEN. So this all works together as part of the law. But it's important to remember there is specific law and guidance around this. So next slide, please. So the statutory guidance. So schools should have a medical support policy, and pupils who have medical conditions that are long-term and complex, they fluctuate, are recurring or high risk, they should have an individual healthcare plan. And all that is in the statutory guidance. So these are things that can and do happen in schools, even though sometimes the message may be given that they don't or can't. So prescription medicines can be given. Staff can be employed and trained to provide medical interventions, including invasive and personal interventions. So earlier on today, someone was saying, well, teachers don't have to do it and you can't get TAs to do it. Well, what you can do and what you need to do is to look at the job descriptions of TAs and people to support, and the child's needs come first. So if you're employing a group of TAs and they won't do that, then you're going to have to employ someone different. You're right, teachers can say no as part of their terms and conditions, but in schools where there is good leadership and commitment to inclusion, then generally you lead from the top and that happens. Nappies can be changed, toileting can be supported, and in cases part-time flexible timetables can be put in place. All of this stuff is possible, all of this stuff happens. So it's important that you know about the law and the guidance, and that no, we cannot do that is not just taken as, all right, well, that's how it is. There are loads more stuff about the law, and I'll give you people that you can talk to, including your Sendia service, but I have to be quiet now.
Thank you, Daisy. That was so comprehensive and short space of time as well. Not easy with the law. So we have the Council for Disabled Children Inclusion Policy here. So this is a practical workshop, and we want to make sure that you're getting something out of each other. Lot of expertise in this room, and what CDC have is an overarching set of principles, because obviously every school culture is different, every setting is different, and what we're looking at is how we embed those principles into the settings we're going into work in. And so we've got 6 key principles with some practical examples, and then we're going to hand over to you. So the 6 principles are: a welcome for all disabled children, building secure relationships and support for families when they need it. Really, really key. You can't isolate You can't help a child or young person with SEN in a silo. Part of helping them is also helping those key people around them, and that includes families, carers, parents, and making sure that they have the information they need to get the support that they need. Respect for difference and a commitment to building friendships and community to the benefit of everyone. Equality of access to play, learning, leisure, and all aspects of life. The active participation of children and their families in decision making. This goes back to a lot of what Daisy was talking about parents being involved in that decision making, and a proactive approach to identifying and removing barriers. Again, thinking about reasonable adjustments and anticipating reasonable adjustments rather than reacting to. And timely access to information and to people with empowering attitudes, supportive skills and expertise. Now, taking each of these principles, what might this look like in a school? Putting the values into practice. So being welcoming for all disabled children could be about making sure that they're part of council, forgotten the name of it, making sure they're part of the school council, if that's part of the leadership and being involved in making decisions in the school, making sure if there's a youth panel of some sort, they are involved and that they're represented at that level, advocating for them. So for those children and young people that need support to get their choices and their needs met, it means sometimes supporting their voice or amplifying their voice. How do we get parents involved? In many settings, there's parents groups involving people at parents' evenings, making sure the right support. So thinking about health teams, how can we become embedded within schools so that parents have access to all of that good information and advice and guidance, bridging the gap between education, health and social care, and sometimes being the key link in school that's able to do that or facilitate that. And when you're working in a school, having a look around, are the children with SEN engaging in the activities with everyone else, or are they in another room doing something entirely different? Are they going out on trips with everybody else? Are they having their lunch in the hall with everybody else, or is there a separate place that they go to? Thinking about inclusion, it's about doing the ordinary, doing what everybody else is doing, and having the tools and the resources to be able to do that. And then we've got a respect for difference and a commitment to building friendship and community to benefit everyone. So it's not good enough to say, well, I can't really ask that person that question because they haven't got capacity. Have we tried everything to get information across in a way that they understand? And many times that's not happened. Many times people say, oh, we haven't got time, or when are we supposed to make resources? But the law says that we make reasonable adjustments and that we make sure that we communicate with people in a way they understand. If we think about the Mental Capacity Act, it's about decisions being context dependent. So we can't assume that people don't have capacity for every decision. It's very much based on the actual decision at hand. And so these are ways that we might communicate with children and young people. Visuals, which I'm sure all of you have come across. Visual timetables so that people know what's happening in their day, using Makaton, using sensory stories when we're working with people and if we want to make sure that we're making sure their sensory needs are met. For those that are non-verbal, we don't assume that we can't interact or communicate. We do things like intensive interaction. There's always ways, eye gaze, PECs. For some children and young people, it might involve puppets. How are you doing it in your setting and what are you seeing around you? And again, we've also got a duty, this is part of Equality Act and public sector equality duties, to make sure that we're fostering good relationships between groups. Daisy's telling me off, I'm going to whiz on, but it basically means how are you making sure your SEN and non-SEN children and young people are interacting positively. Quality of access to play, learning, leisure, and all aspects of life. So we can't say that children and young people aren't able to do something if we haven't actively tried all the ways that we can to make sure that they can do something. Some children and young people might need sensory breaks in between doing maybe a session with a speech and language therapist and then going back into a lesson. Some might need checklists, some might need objects of reference, some might need movement breaks, some might need access to any of the transportation, etc. We shouldn't be excluding people from going on trips. They should go everywhere where everybody else goes. And if there's things like going to a disco, shouldn't be for set times for children and young people with SEND. They should be able to go when everyone else goes. And so there's 3 more principles in the CDC framework. And we would like you just very quickly, Daisy, are we okay for time?
I mean, essentially not. So very quickly, people.
Very quickly, we'd like your ideas. You guys are the expert in going in and doing and working with children and young people in some capacity. So if you could fill in the last 3 principles with your ideas, that would be absolutely great. So if you're not experienced with Jamboard, there's post-it notes. You write a point on a post-it note. There's 3 pages for each of the principles. So jot some ideas down before we have to leave you. The link is on the page.
I think Kate might need it in the chat.
Okay, so I'm going to stop
she's
sharing for a
doing it
second and
on
do
a
that.
phone and on Teams.
Very well done, Kate. You're doing a better job than I would.
Yeah, they can't. Yeah, I can't click the link, so I think I
Okay.
need it.
No worries. Oh my gosh, that's big.
That works.
Brilliant.
That's working.
Is that working for people?
Yeah, that's perfect. Thank you.
Awesome. So we will share the ideas that people bring to the workshops, because it's about how do we make our own settings more inclusive? How do we embed these principles? Okay, so I'm just going to read out a few. For active participation of children and their families in decision making, we've got ask the child what would help, clear input into EHCP outcomes, development plans and transition choices, training for commissioners around funding. And we've got family support workers are great, but do need funding. Funding's coming up a lot as parents often require a bit more communication from schools and opportunities to meet. Co-production with children and young people needs greater emphasis. Absolutely agree. Daisy, time check.
I mean, we have to go. Is essentially the time
Okay.
check. However, so at the end of the slides, there is a link both to kind of send our services and to all kind of different organisations that can support parents, children, young people, and have lots of resources around the law. So if you are struggling with any of that, look at them, and you will. My email address will be on something, and you're more than welcome to email myself or Reshmi, and I think everyone has to go to their new workshops.
And I think the slides are going to be sent out as well. So apologies for rushing through some of them.
Thank you.
But it was lovely to speak with you all, and thank you for being active. Take care,
Thank you
everyone.
for putting up with us and our technical not excellence.
Take care.
Take care. Bye-bye.
Bye. Right, now I think we have to go to the next one, but then it's just a different link.
Daisy, do we have to press stop recording or anything?
Oh yes, let's stop recording. There we are, stop recording.
Okay, is it straight